So, hi everyone. I have Dr. Deepak Bansal with me. He has secured an amazing rank 21 in INICET May 2023. Heartiest congratulations, Deepak. This is a moment to be proud of. How do you feel?
Thank you so much, ma'am. It's all the thanks goes to DAMS team and you, Sumir sir.
That's really kind of
Literally
you.
the feeling is scared yet sinking in. It was such an unbelievable rank. I was expecting a decent rank, but this under two-digit rank was literally unbelievable.
और टू
A
डिजिट में
pleasant
भी
shock for me.
बहुत अच्छा आया है बेटा, 2 डिजिट में भी बहुत अच्छा रैंक आया है। तो इसमें
Yeah,
बहुत आपकी भी मेहनत लगी है और मुझे पता है कि आपने बहुत डेडिकेशन से पढ़ाई करी होगी और वही जानने के लिए आज हम कोशिश कर रहे हैं टू फिगर आउट कि डॉक्टर दीपक ने ऐसा क्या किया व्हिच मेक्स हिम अ टॉप रैंक होल्डर, है ना? सो दीपक, सबसे पहले तो मैं आई जस्ट वांट टू से दैट वी ऑल नो दैट इट इज अ कॉम्पिटिटिव एग्जाम एंड a very prestigious one, so it puts a lot of burden on you as well कि अच्छा हम INI सेट का एग्जाम देने लगे हैं, है ना? मुझे ये जानना
yes,
है
ma'am.
कि आपने नीट टीएनडी किया था, उसके बाद INI सीटी टीएनडी भी किया था। तो ओवर अ
Yes,
पीरियड ऑफ टाइम आपने अपनी स्ट्रैटेजी को कैसे बदला? मतलब शुरू में क्या कर रहे थे, फिर मिडल में क्या कर रहे थे, फिर नीट के बाद हमने क्या किया? तो अगर आप थोड़ा-सा उसके बारे में हमें बता पाओगे दीपक?
yes, ma'am. Ma'am, till November of 2022, like I was using NEET TND.
हाँ जी,
And ma'am, I was using my main notes like very wisely and like smartly. So
ओके,
till November, I have done my main notes like in great depth, and I think in this INICET that helped me a lot.
ओके,
Ma'am, in after November, in December, DAMS DVT was like a fest for these nerdy people. It was such a lively event for me. Like I enjoyed you dancing, saying "Bacha ji, haan ji," Sumer sir dancing. It was such a good event for me. So I
Yeah,
used to sit in my library.
we we try to lighten the mood, although we are not the best
Yes, ma'am.
dancers or whatever memers, but we just try to, because we understand that you are under stress, and um,
Yes, ma'am.
we have to push at the right time, we have to cushion you at the right time, तो हर चीज का combination बच्चे को चाहिए होता है ना?
Definitely, ma'am. I used to miss the DVT after 17, like it is gone literally. So it was very nice. And ma'am, it is, as Sumer sir said, it's like NEET PG ka first aid only. So I used to
Okay.
read my DVT, like I have read it 7, 8 times before my NEET PG. And in between
Wow.
NEET PG and INSET, I have read it again for 2 times.
Wow.
So
Okay.
that was literally for first aid for me. Apart from this, ma'am, I should like literally say like DAMS GT, the best thing is that they are providing us with the video solutions. So that is the one feature that I like about DAMS a lot. And
Okay.
also I followed your strategy of writing like mistakes, memory based, exam skill.
हाँ जी,
Shouldn't have
हाँ जी।
attempted this question. Like I have wrote this
Yes.
for entire of my all of my GT. So that played a major role in my preparation, ma'am.
Wow. So did you see that your correct questions kept increasing?
Definitely, ma'am. Initially, I don't like. I was getting a good rank, but uh, with time, it increased and it increased my confidence as well, ma'am.
दैट्स वंडरफुल, दैट्स वंडरफुल। अच्छा बेटा, आपने दोनों एग्ज़ाम दिए हैं, नीट भी और आईएनआई
Yes,
सेट
ma'am.
भी। तो आपने दोनों एग्ज़ाम के बीच में क्या किया? एक तो आपने बताया आपने डीवीटी किया। हाउ
Yes, ma'am.
एल्स डिड यू गियर अप फॉर द आईएनआई सीटी? क्या उस वक़्त आपने आईएनआई सीटी टीएनडी लिया था या पहले ही ले लिया था?
Ma'am, I have the INICET TND in January,
ओके,
but it got like it was for 2 months, I guess. Like it expired after NEET. So
ओके,
Mr. Rajesh, like Lucknow coordinator at DAMS, he was so generous enough to extend it for 1.5 month for me. And
हाँ
so
जी,
I started giving TND again and test again, and used to attend the discussion of like 5 or 6 subjects I have attended in between this time, NEET and
ओके,
INSET. So, ma'am, that was like that was taking me to the track again. Like after NEET, you feel little lazy of the track, so
येस,
it kept
येस,
me
एंड
on
यू
the
नीड
track.
टारगेट्स।
Yes, ma'am, definitely.
ओके। एंड मुझे ये बताओ दीपक, कहीं पे आपने जैसे आप बता रहे थे कि आपने अपना एक नोट बना रहे थे व्हाट यू वर डूइंग रॉन्ग, सो
Yes,
जब
ma'am.
आप रिपीट एक सब्जेक्ट पढ़ रहे थे तो वर यू गोइंग इन अगेन रीडिंग ऑल ऑफ इट और वर इट स्पेसिफिक टॉपिक्स, और क्या हमने उस वक्त आईएनआई पीवाईक्यू का बाप का यूज लिया टू सॉर्ट ऑफ अंडरस्टैंड वेयर वी नीड टू वर्क हार्ड?
Ma'am, I did watch like INICET PYQ Kabab for minor subjects.
ओके,
Like I was not having time in between this time, like so I watch only minor subjects for PYQ Kabab, and that definitely helps. Like I will say that I have not read psychiatry from anything else like other than Sachin sir. only those
Okay,
DBT notes and his TND notes. That is what the resource that I have for psychiatry.
great. And also, can you tell us about your exam strategy? We all know that those 3 hours are very, very important. तो तब हम किस माइंडसेट से पेपर अटेम्प्ट कर रहे थे? हाउ अग्रेसिव डिड यू गो? एंड कुछ ऐसे सवाल आए होंगे जो आपको लग रहा होगा कि ओ आई डोंट नो दिस, बट हाउ डिड यू टैकल दोज? हाउ मेनी डिड यू कीप फॉर रिव्यू?
Definitely, ma'am. This INICET was like little atypical, I guess. It was little hard, and
अच्छा,
in Optha, I get 8 questions of Optha in a patch, and Optha was like a bouncer to me in this INICET. So
ओके,
that was a rough patch for me. But I believe that we have some questions in our packet, so we'll do it and we'll maintain it. So I attempted aggressively, and ma'am, time was not an issue for me in this INICET. I finished 40 minutes earlier
अच्छा,
and have marked, not exactly marked, I have written on my admit card 32 questions for review that I have to attempt.
ओके,
So on
सो
the in the last 40 minutes, I attempted them and I had
ऑलराइट,
admit 199 questions, ma'am. Like I was aggressive.
वेरी गुड। आई थिंक वो फ़ायदा भी मिला है दीपक, अग्रेसिव जाने का और रूल आउट के तरीके से करने का आपको फ़ायदा मिला है। सो
Definitely, ma'am. Ma'am, 180 questions were doable, I guess, in this INI set. And at 193, I stuck at 7 questions, so I attempted like even two will get correct, it will neutralize. So I attempted like them.
चलो गुड गुड कैलकुलेशंस है ना। अच्छा और एक
Yes,
और चीज़ बताओ कि हर आईएनआई सेट में देयर विल बी सम वेग थिंग्स दैट दे आस्क राइट, सम थिंग्स व्हिच आर आउट ऑफ द बॉक्स। तो अगली
yes, ma'am.
बार फॉर एग्जांपल इफ समवन इज प्रिपेयरिंग नाउ फॉर नवंबर एग्जाम, हाउ मच स्ट्रेस शुड दे पुट ऑन दीज अनयूजुअल थिंग्स?
I don't think that we need to put stress on unusual things. As Sumir sir said, that 30% of the 70% of the paper will be from 30% of the syllabus. So we need to do these usual things only for the main. And if
Yes.
we have got time, like we can solve the PYQs and do explore those topics if they are rare. But instead of going for recent updates, recent drugs, that will be of like little benefit for, according to me.
ओके एंड कुछ आप पेपर वेटेज के बारे में बताना चाहोगे या डिफिकल्टी लेवल विद रिस्पेक्ट टू सर्टेन सब्जेक्ट स्पेशली?
Yes, ma'am. Ma'am,
एनीथिंग दैट
definitely,
यू
ma'am. Paper.
फील कि
Yes,
जो
ma'am.
बच्चों को पता होना चाहिए? सो इफ दे आर प्रिपेयरिंग फॉर द नवंबर एग्जाम, व्हाट थिंग्स शुड दे कीप इन माइंड नाउ बिफोर दे स्टार्ट?
Ma'am, undoubtedly, INI heavily relies on first and second year subjects, and that to mainly pharma, patho, micro, and BChem. So
हम्म,
we need to get them stronger. And for difficulty level, I must say that OFTHA, I have seen the papers like they are definitely bouncers. Some questions will be definitely bouncers. PSM Biostat was complete bouncer for me. So like
आई
I
थिंक फॉर
was not able
एवरीवन,
to.
नॉट जस्ट फॉर
Yes, ma'am.
you, they were
Definitely.
I think answers for everyone. Okay, fair
Yes,
enough,
ma'am.
because that means that these questions are not really contributing to the rank. Right? So we
Definitely.
have to go with the mindset that if it is vague, if it is unusual, it is going to be the same for everyone. So when you're
Yes, ma'am.
preparing, let's not waste a lot of time on these topics. Let's focus on topics which have high probability of being asked every year. Right?
Yes, ma'am. Yes, ma'am.
Okay. And abhi aapne bataya first and second year is, we all know that as compared to NEET, it is more asked in INI set exam. तो मुझे बता बेटा
Yes, ma'am.
इसमें कुछ सब्जेक्ट्स हैं जो बहुत वॉलेटाइल भी हैं लाइक फार्माकोलॉजी माइक्रोबायोलॉजी दे वेरी ड्राई आल्सो तो कुछ एनी
Yes, ma'am.
स्पेशल थिंग दैट यू कैन टेल फॉर बायोकेम और दीज सब्जेक्ट्स हाउ टू retain them longer, what was your way of doing them?
Pharma, micro, and like pharma, micro are and ophtha are the subjects that no matter how much time you read, you will forget it. They are so volatile. So I was like before my aims before the exam, I have divided the times and I used to study daily for pharma and micro for some
ओके,
time. For
ओके,
1 hour, 2 hours, I used to complete one
मतलब
chapter,
वो
one
कुछ
unit
स्पेसिफिक टॉपिक्स
daily.
थे जो आप पढ़ते थे?
Yes, ma'am, I have marked it in my main notes. Like
अच्छा,
those are the
ओके,
most volatile topics. And definitely, I used to do other subjects, but used to give 2 hours for 10 days, like before my INICET daily. So I think
दैट्स
that
ग्रेट.
helped me for remembering the volatile things.
Yes, I am sure that is a very good way of doing it. We always say if it is vast, if it's too volatile, you break it into smaller parts and you do it every day, like a capsule, you take it every day. That's
Yes, ma'am.
wonderful. And अब मुझे ये बताओ दीपक कि when somebody is starting now until November, can you give them a little idea about timelines and strategy they should follow for the November exams?
Ma'am, since ma'am, like there are 5 months, 5 to 6 months for the INI November, I
मतलब
will
अगर आप
definitely
होते
like
तो आप इन हाँ, आप इन 5 मंथ्स में कैसे करते?
Ma'am, I would start with the PYQs. Despite
ओके,
the paper was lack or less on PYQ, but I will start with PYQ and will start with TND notes if I will be
ओके,
at this place. Yes, ma'am. And
ओके.
I will try to finish that all the 19 subjects first read by 2.5 months, and then start the cycle of revisions. And at least 2 to 3 revisions I would have done before this INI.
अच्छा और इस रिविज़न में आप रेट्रोग्रेड करोगे? कैसे करोगे?
Yeah, yes, ma'am. Ma'am, by giving GT, I think that GT helps you a lot. Exam seems like a
ओके,
GT if you have given a number of GTs.
दैट्स
So
राइट.
I will do it like that, where the subjects, the points that I will be weak in, I will revise it from the main notes.
ऑलराइट, परफेक्ट. एंड अब मुझे बताओ व्हाट ब्रांच डू यू वांट टू परस्यू बेटा?
Ma'am, medicine most probably.
ग्रेट, ग्रेट एंड आई एम श्योर यू विल डू वेल. एंड अब मुझे बताओ
Thank
दीपक
you.
कुछ अपने बारे में नॉन एकेडमिक व्हाट एल्स डू यू डू यू नो टू कीप यू मोटिवेटेड इनफ टू स्टडी?
So, ma'am, I will go out with my friends. I'm a homey person. I will talk to my mother, and definitely she will break my all anxiety away. She will take my
दैट्स
all
नाइस.
anxiety.
यस.
I'll talk to my mother, my friends, and I used to walk in my campus with my friend. That used to anxiety booster for me.
ग्रेट. एंड अभी अभी कुछ प्लान है क्या करने वाला है जब तक काउंसलिंग नहीं हो रही है? हाउ आर यू गोइंग
Yes,
टू
ma'am.
ब्रेक फ्री?
Ma'am, I'm like having some extensions for 2.5 weeks in my
अच्छा,
internship. Then I go to a trip with my family.
चलो दैट्स वंडरफुल. यू डिजर्व इट. इट्स अ वेल डिजर्व्ड ब्रेक, है ना? एंड नाउ कैन यू टेल
Mhm.
समथिंग टू द जूनियर्स और योर कलीग्स और whoever is listening to you, something about the mindset that they should have when they are appearing for, let's say, INICET or any other competitive exam?
Ma'am, the journey of PG is like very tiring. So I must say that if you feel tired, you must know how to rest, not to quit.
Yes,
That is what I feel. And while appearing in the exam, go with a sane mind. If you are feeling a rough patch is there, take a step back, like take deep breaths, or like remember your God Almighty, the one that you praise for whom you
how
are doing
sweet.
this, and then come again with the like same effort and same zeal.
दैट इज़ रियली वेरी स्वीट. दोनों बातें आपने बहुत अच्छी बोली बेटा. दैट्स रियली नाइस कि जब आप थक जाओ तो क्विट करने की जगह रेस्ट करो. यू शुड टेक दोज़ सिग्नल्स फ्रॉम योर बॉडी, टेक ब्रेक एंड ensure that you are in a good mental state because that ensures that you will perform optimally physically as well, है ना? सो
Yes, ma'am.
बहुत अच्छी बातें करी दीपक. एंड आई विश यू ऑल द वेरी बेस्ट. द एंटायर डैम्स फैमिली congratulates you and wishes you a bright future ahead. Also,
Thank you, ma'am.
we would say thank you for making us a part of your journey, beta.
Thank you, ma'am.
It was an
I
absolute
would like to
pleasure.
thank
Hanji, hanji.
I'd like to thank you, Dr. Sumir sir, Dr. Deepak
Thank
sir,
you, beta.
ENT, Dr. Sandeep
Thank
sir. Definitely, ma'am, you are like the pillars of my this rank result.
That's very kind of you. We will try and keep supporting in whatever best way we can because eventually it's your hard work. But we understand that we all need help from each other at times. Yes. So
Yes, ma'am.
stay connected, Deepak. We will meet you personally also very soon. Sending you all the good wishes and keep smiling and keep doing great in life. Thank you so much.
Ma'am,
Hanji
hello.
beta. Hanji
Ma'am, I would
bache.
like to wish my mother's a happy Mother's Day on this day.
Wish,
And
yes,
like
absolutely. See,
yes,
nothing is
ma'am.
possible without your mom. They keep guiding you,
Yes,
they keep supporting you, they have this immense faith on you. So, yes, wishing a happy Mother's Day to every mom on the planet. And their
yes, ma'am.
contributions cannot be, we cannot even think about existing without them.
Yes, ma'am. Would like to thank my Bua, Fupa, Papa, and all who were the part of this journey. Thank you.
Now, you're a very sweet boy, Deepak. All the very best. Take care and wishing you good luck, bache.
Thank you, ma'am.
Take care. Take care.